So most guys swear their blood pressure is normal, and then the nurse or provider walks in with a white coat, a stethoscope, and a blood pressure cuff, and all of a sudden their blood pressure spikes up. This is usually referred to as white coat syndrome. And white coat syndrome is real. It is a diagnosis. And it can be a really big indicator that there is something more going on with your blood pressure. But a lot of times it also just means you just got anxious and your blood pressure spiked up when you went to the doctor's office. Most people that get this white coat syndrome, oftentimes their blood pressures are normal at home. However, if it's elevated in the doctor's office, they may unfortunately get prescribed medications they don't generally need, or alternatively, they may not be given the blood pressure medications that they need because it's just white coat syndrome. So in order to kind of squash all of that, you want to make sure to check your blood pressure at home a few times a week. Make sure you're seated in a quiet environment, your back is supported, your feet are flat on the ground. You check your blood pressure. Now we prefer a blood pressure cuff that you can put up on your upper part of your arm, not the wrist ones as they're not as accurate. So feet are flat on the ground, back supported, you've waited a few minutes, you're calmed down, blood pressure cuff on, hit the start button, see where your blood pressure and your heart rate is. You may want to take just a couple just to get an average. Now, through the week, we're looking to get your blood pressure around 115 to 120 for that top number and 70 to 80 for the bottom number, at least 80% of the time. Keep those numbers on hand so when you do go back to your provider's office, you can say, hey, at home, these are my blood pressure readings, this is my heart rate readings, and so they can compare to what they get in the office so you don't get treated if you don't have to, but also get the appropriate treatment that you might need if it actually is high at home. So don't be afraid, it's just a white coat, but it's important for you to know your blood pressure at home. It is known as the silent killer.